Hi, and welcome to Askimo TV. I'm talking today to Dan Smith. Dan is the Director of Sports and Spinal Physio in the UK and is a lead physiotherapist. Hi, Dan. How are you?
Hi, Joanne. Very well, thank you.
Dan, we're going to talk today about head and migraines and how the physiotherapist can help in this regard. So what's the difference between a migraine and a headache?
Essentially, Joanne, the main difference between a headache and a migraine is that a migraine will have associated features such as dizziness, nausea, vomiting, sensitivity to light or sensitivity to sound. Headache patients generally don't have these features.
Tell me briefly about the research behind physiotherapy and how it can help people suffering from headaches and migraines.
There's increasing evidence to suggest that headaches and migraines are related to oversensitization of the brainstem. The brainstem is the part of the brain that sits below the brain, and it's the top of the spinal cord. Now, this part of the brain, the brainstem receives information from the upper neck joints, so the upper three neck joints. It also receives information from the face and the head. Now, if the patient has a problem with the upper neck, the information from the upper neck can make the brainstem very sensitive. And then information that's normal and coming from the head can be exaggerated and felt as migraine symptoms such as head pain and the nausea and other associated features they get. Essentially, we believe that if we treat the neck and improve the condition and the health of the upper neck, the brain sensitivity lowers, and then the patient's less likely to experience headache and migraine.
What physical therapy approaches are most helpful for chronic headaches and migraine sufferers?
The first goal is to decrease any joint stiffness or muscle tightness in the upper cervical spine, so the upper neck. So we would use hands-on techniques to do this, manual therapy techniques such as mobilization or manipulation. And additionally, the patients we taught to exercises to improve their posture and their alignment. Some patients have increased mobility of the upper neck. We call this hypermobility, and they may require exercises to improve the control and support of the upper neck. And then additionally, there's lifestyle factors as well. So their ergonomics, how they sit at the desk, the pillow they use in their bed, their driving positions, how they look after their neck effectively during their everyday lives.
Does physical therapy produce permanent pain relief?
This is like any condition, really. First of all, the patient needs to complete the treatment program and continue to do their home exercises if they're to stay out of trouble. What we find in our clinic is about 30 to 40% have a complete resolution of their headache or migraine symptoms with our treatment. There's the next 30 to 40%, they have an improvement, but they often require ongoing treatment to manage this. And then the last group of 20% don't really respond to our treatment and normally require other medical management.
How do you define a successful physical therapy outcome?
We monitor all of our patients using something called a HIT6, which is a questionnaire they get at the start, at the end of their treatment, and then at 3 months and 12 months. And this HIT6 essentially assesses their functional outcome score, so how much pain they're in, how it affects their lives. And what we're looking for is an improvement in this score. So any improvement is deemed as a successful outcome of our treatment.
What can or what should or shouldn't people do at home that can try and help them prevent the things that are causing the migraines and the headaches?
Well, I mean, from the neck point of view, we're looking for the person to really take care of their neck, so ensuring that their desk is the right height and the chair is adjusted correctly, their screen is adjusted correctly as well. All the lifestyle things I recommended before are important. If you can get those right, then the upper neck will stay healthy and happy and won't sensitize the brainstem. If the brainstem is sensitive, it can often be a migraine can often be triggered by other factors as well, such as ingestion, so cheese, red wine, chocolate. But essentially, these are only triggering the migraine because the brainstem is already sensitized by a stiff or unhealthy neck. So if we can get the neck healthy, then often the patient can go back to drinking red wine and eating cheese again and not have a migraine.
Thank you, Dan. Thank you so much for talking to me today.
You're very welcome. Nice to see you.